Hi everyone, I'm Revathi Rajagopal. I'm an Onco Psychologist working with the Medical and Hemato-Oncology Department at Rajagiri Hospital. As we know, October is the Breast Cancer Awareness Month, and I'm here to talk about what are the emotions primarily that a person with cancer experiences soon after the diagnosis, and what are some of the ways in which they can handle this period in a more adaptive manner. So, according to the National Comprehensive Cancer Network, NCCN, 80 to 85% of patients experience something which is known as emotional distress. Now, as per the definition, distress is a multifactorial unpleasant experience that can be physical, psychological, social, or spiritual in nature that interferes with the ability to cope with the disease, with the treatment, and its physical symptoms. Now, can actual emotional distress impact individuals, and how can that happen? Let's understand that a little more. Distress ranges from a continuum, starting from normal feelings of sadness or vulnerability or even fear, and it can go up to disabling feelings of anxiety, depression, or even social isolation. Is emotional distress normal, or should it be treated? The first emotion that patients with cancer experience is shock or disbelief, or questions such as why me, or why has this happened to me? Some of them experience even feelings of helplessness or worry about the changes that can happen in their appearance or body. According to a model which was given by Kubler-Ross, there are 5 stages of grief that a person goes through soon after diagnosis, a cancer diagnosis. The first one is denial. Second phase of grief is bargaining. The third is anger. The fourth is depression, and the fifth is acceptance. So, denial and acceptance are at 2 extremes which a person can experience at the beginning or at the end. The other 3 phases, which is bargaining, anger, and depression, can occur at various phases and need not happen in a sequence. Now, what are some of the ways in which a person can handle their emotional distress? The first way would be to own the process, to get clarifications from the medical team or the doctor in terms of the diagnosis, the treatment details, and ways in which they should move forward. So, having a very open and transparent communication with the oncologist is very important. The second would be to have a routine which is not new, something which they've already practiced and which can be enhanced a little more further. Because what happens is many of the patients soon after the diagnosis feel very lost and feel loss of control over their whole situation. So the best way to feel empowered and the best way to get a sense of control would be to follow their old routine but enhance it a little further. Many times we have heard people say, be positive and be cheerful. But is it so simple? Of course, it comes from a space of good intent. But that puts in a lot of pressure on the patients, and oftentimes they're not able to express their true feelings. So it's important to give patients a space of safety and confidentiality where they can express their true emotions, and a space where they can handle it professionally. And that's where this realm or science of psycho-oncology comes in. The other important thing would be to stay in the present. So mindfulness is a concept that is talked about very frequently in today's times. So the focus on the here and now, not thinking too much about the future, because that can only increase anxiety or uncertainty. Now, patients, of course, as we know, experience a surge of emotions during their cancer journey, but alongside, even caregivers or family members equally experience emotional distress. So what are some of the things that they can do to make the process a little more smooth and effective? The first thing would be, of course, to take part in the patient's treatment very actively, to go with them to hospital visits, to understand the diagnosis and treatment details from the doctor, form a schedule, and support the patient emotionally. Make them independent, make them empowered rather than making the patient dependent on them. Also, it's important for caregivers to take care of the self. So, self-care is a concept that is very significant. Oftentimes, family members don't take care of their own health or their emotional well-being. So, taking out time for themselves, connecting with their friends or loved ones, venting out, acknowledging their emotions, probably taking even professional help is important. So it's important for patients and caregivers to support each other in this journey and empower each other for a better quality of life. So I would end by wishing everyone a very happy Breast Cancer Awareness Month, and all my best wishes to those who are currently undergoing treatment or even those who have completed it successfully.